Good morning and welcome to Ark and Dove Presbyterian Church in Odenton, Maryland. I'm Brian Boudreaux, the clerk of session here at Ark and Dove and your host here in the lobby. The weekly pre-service broadcast about the life of the church. So today is the Transfiguration of the Lord. My guest today is Dr. Nilesh Kalyanaraman, the Anne Arundel County Health Officer. So I'm really excited about that. We'll get to the latest on the county's vaccination efforts, but first, let's dive into some announcements. So we have several events this week as we head into Lent. This Tuesday, February 16th is Shrove Tuesday. So this year, we will celebrate with a Zoom party at 6 p.m. So make your pancakes at home and join everyone for fellowship. The information will be emailed to you or is in the bulletin. Then Wednesday is Ash Wednesday. There will be a live stream service at 6:30 p.m. So tune in to YouTube or Facebook Live. And let's talk about the Imposition of Ashes. This will take place both before and after the service from 5:30 to 6:15 p.m. and from 7:15 to 8 p.m. It will be drive-through style, and you are asked to wear a mask. And this is how this is going to happen. You're going to drive to the parking lot, and a double-masked pastor will either place the ashes on your forehead or hand you ashes, depending on your preference. So we're asking everybody to stay in your car and just roll down your windows. This way we can maintain social distancing and still be able to do the ashes. So our Lenten book study is Howard Thurman's Jesus and the Disinherited. I just got my copy this week and I'm leafing through it and it looks amazing. It's easy to read, so I encourage everybody to join. So pick up Jesus and the Disinherited wherever you buy your books. And we will discuss each short chapter during Lent in small groups. And there are now 5 Lenten study groups for you to choose from. So sign up for any of these groups. So we've got beginning this Friday at 7:30 p.m. with Kim Champagne, beginning next Sunday at 4 p.m. with Stephen Price Gibson, beginning next Tuesday, February 23rd at 7:30 with Pastor Tim, and then next Wednesday, February 24th at 10 a.m. with Pastor John, and next Thursday, February 25th at 7:30 with Katie Nelson Johnson. So you can find the email addresses in the archive to sign up. During Lent, we will accept our annual One Great Hour of Sharing offering. Stay tuned for the breakdown of how our generosity will be spread around the world. Would you like a brief devotion in your email each day of this Lenten season? Beginning Ash Wednesday, you can receive a devotion, which includes a Bible passage, a brief reflection by Howard Thurman, and a prayer. So please contact admin@arkanddove.org if you would like to receive these devotions in your email. The Gleam team will be hosting a book club this Tuesday, February 16th at 7:30 p.m. on Zoom. The group will be reading the book Outside the Lines, How Embracing Queerness Will Transform Your Faith by Mahi Kim Court. So contact Amanda Cross for more details and to sign up. So Godly Play continues every Sunday from 9 to 9:40 via Zoom for kids grades K through 5. If you're not already signed up for that, you can contact Julie Devers. Logos is still going on with weekly activities. If you're not receiving the weekly email, please contact Amy Goldberg. And the weekly Bible lectionary is every Wednesday at 10 a.m. Contact Pastor John for a Zoom invitation. And we also have some regular standing social activities, including Sunday fellowship right after the service at 11:15. If you don't have the Zoom invitation for that, you can email fellowship@arkanddove.org anytime during the service. The crafting group meets on the first Monday and third Wednesday evening of each month at 7 p.m. via Zoom. Amy Tardif has that Zoom invitation for you. Saturday night game night with the deacons. You can get a Zoom invitation from Ellen and Greg Makar. Finally, Friendly Seniors Tea at 3 every Thursday via Zoom. Pastor Tim has the Zoom invitation for you there. Today, I have the real honor to have with me on the lobby Anne Arundel County Health Officer, Dr. Nilesh Kalyanaraman. Dr. K has been our county health officer since September 2019 and has been with us through the entire COVID-19 pandemic. Before that, he worked for the city of Baltimore and is an internal medicine specialist. So welcome, doctor. It's a real pleasure. Thank you for agreeing to join us.
Thank you, Brian.
It's been 11 months since our congregation has met in person, and we have a generally cautious population. And we have seniors, young people, federal and local government employees, as well as teachers. So our community generally supports getting vaccinated and has supported, social distancing and mask wearing and, science-based measures that the county has recommended to stop the spread of the virus. So with the vaccine rollout, we are seeing a glimmer of hope finally, and I'm hoping that you can help us understand better the vaccine, how it's being implemented, and what our future looks like. So the first thing I'd like to ask you is, we are getting emails from the county, from the state, from doctors' offices, medical systems, our pharmacies, all saying, sign up for an appointment or a notification to get a vaccine. So should I be signing up for multiple appointments? What should I be doing?
Yeah, so I would say that if you're in phase 1B or 1C, do sign up. Sign up in multiple spots. The system we have in the state is really decentralized. And so it really just depends on when your name comes up on whichever list. I know it's tough to do that, but that's the system we got.
So as of today, what phase are we in? And does that differ from the state phase?
So for the state's perspective, we're in 1C. And you'll see that the retail pharmacies and the mass vaccination sites are taking anybody in 1A, B, or C. At the health department, we're really focusing on those who are most vulnerable and those in the kind of highest priority sector. So we're still in 1B. So that means we're focusing on 75-plus-year-olds, teachers, custodians, others who work at the schools, because we really want to make sure we get those who are at the highest risk.
So can you talk about the difference then with what the county is doing and then what, say, pharmacies and doctors' offices are doing for administering, and what's the relationship between those?
Yeah. So the county, and you'll see the doctors' offices too, we're really focusing on those highest risk individuals, right? And then so there's that system or that philosophy, I guess, probably a better way to say it. And then you have the pharmacies and the mass vaccination sites, which are much more first come, first serve. As long as you're eligible, we're going to take you. And the two systems, one is making sure that we are getting those most at risk, and the other one is focused more on speed, and they complement each other.
So if I'm a healthy adult, and we're in phase 1C for the state, and I sign up, am I taking away a slot from somebody less healthy?
So as long as it's your phase, you should sign up, and when it's your turn, you should get vaccinated. From our standpoint, everybody's going to get vaccinated at some point, and we've made decisions that certain occupations or sectors are more important in terms of getting them vaccinated first. So please do get the vaccine.
You said certain sectors you have a focus on. How did you guys make that decision originally, and was that in consultation with the state and national level?
So that flows down actually from the national level. So at the national level, the CDC put out its guidelines for who should, which sectors and occupations should come first, second, third, based on their importance to society and the risk exposure. The states is an adaptation of that. And then ours is really in line with what the state is saying. We're just saying we're going to wait and get all of those folks before moving on. That's really the main difference.
Okay, so what about people who have poor or no internet access, and we have elderly folks who may not have access to the internet or not know how to do that? So how will they get an appointment for the vaccine, or what is the county doing to help?
That's critical, and I'm glad you brought that up. So we have our phone lines available: 410-222-7256, and you can call in. We'll get you on the list, and when it's your turn, we'll give you a call and get you into an appointment. We do not want people without internet access to fall to the back of the line. That is not going to happen.
So if I have a parent or a neighbor who needs help, can I call on their behalf?
You can call on their behalf. You can also pre-register them if you're able to do that as well. Either way, whatever works for you is good for us.
Excellent. Now, when I read the qualifications for each phase, and I'm not sure if I qualify or how do I find out, as I try to figure out where I fit, I've noticed that the state websites say some things, and that may be a little bit different than what the county website is. So how do I make sense of it all at the base? Like, what is there a primary source that I should be looking at? Because there are some qualifications like on the state website that, um, that may not even be clear. I may think I fall into that category, but I'm not sure. So where can I go to figure that out? Is there a place, and does county supersede then the state in that respect?
Yeah. So I think the bottom line is you're going to have to take a best guess at where you fall in. What we're finding is that for most people, they have a good sense of which category they're in, but there's definitely people who, you're just not sure, like, am I in this category? Am I that? Do I qualify? And that's tough. But, what we're saying is take your best shot at it. You're certainly welcome to call us to figure that out. But hopefully in the next few months, as we see vaccine availability expand significantly, some of these questions will become less important.
Okay. So like somebody I saw on the state website, for example, individuals with intellectual or developmental abilities, and I also saw autoimmune disorders. So those can be very broad categories. So what would I do? Do I call the number, or do I, how do I figure that out?
We're working through that. So that's a really great example. So we're working through that right now with the ARC on how to actually put that into place so that people who qualify for that, because that's a bit different from almost all of our other categories. It's related to a health condition. And so that requires just a different approach from the age or sector approach. So we're working through that right now.
Okay. Now you talked about, the vaccines, or mentioned that. So can you talk about like the county's goals for getting people vaccinated? And are you concerned then also about the variants and the effect on the vaccine?
Our goals are really to do a couple of things. Make sure that our vaccinations are equitable, meaning that we are getting those who are at highest risk. We've seen that with Blacks and Hispanics have higher rates of infection, and for Blacks, higher rates of death. Making sure we're doing that. Making sure we're targeting those who are older. They have also had higher rates of death. And then those occupations where there's more exposure. So we're really focused on that equity piece of it. And then, we want to get it out fast too. So, we're not sacrificing speed. We're just putting a little bit more effort into the equity piece to make sure we do that right. What we see is that as we get kind of our finite number of vaccines, it's hard because, we're trying to make sure that we are equitably allocating it across all these groups. And so that's going to continue to be our focus, is the equity piece.
So when we hear about the numbers of vaccines that have been purchased, that are going to be dispersed and across the country, and then the number of vaccines that we're trying to acquire in the state of Maryland, does Anne Arundel County then get its fair share of that? And how also, like, the numbers for the pharmacies that are dispersing that, is that included in the numbers that Anne Arundel County, number of vaccines that Anne Arundel County gets?
So the state is the one that's making these allocations to health departments, to hospitals, to pharmacies, to the mass vaccination sites. We as a health department don't do that. That's all controlled at the state level. In terms of the vaccines coming into the county, right now we do want more vaccines to come into the county. Our big challenge in getting our percentage of the population higher of vaccinated is that we just need more vaccines. It's flying out of our hands and others' hands into arms right now. So, but everybody's in this position, right? Everybody wants more vaccines.
Right, exactly. So there are mass vaccination sites for the state of Maryland, like the one at Six Flags. Does Anne Arundel County have any plans for creating a mass vaccination site?
So we've got a couple of large vaccination sites right now. One at the community college, one at Maryland Live, the casino. And we're also looking at the Naval Stadium. Really, our rate limiting step right now is we don't have enough vaccine to stand up another site. We're already pushing it out. So that's kind of we're waiting for more. And as soon as we are, we'll set up more sites.
So what is the threshold then for the county for the rate of vaccination or level of vaccination to begin lifting some of the restrictions that we have?
There's a larger population target of getting 70 to 80% of people vaccinated. That's when we'll start to see the population. That's when we'll see the population immunity effects. But we'll start to see effects well before that. And I think what we're going to have to wait and see is, what is that threshold? To some level, because we're focusing on the highest risk people first, we should, once we get enough, we should start to see our hospitalizations go down. And that will help a lot in kind of rolling these restrictions back.
So you have to make the decision then based on not a specific threshold that you're looking at, but you have to look at the trends. And then at that time, you'll begin to make those decisions. Is that correct?
Correct.
Are there health conditions that would prevent somebody from getting the COVID vaccine, such as having a cold or a flu or other medical procedures?
So there's nothing that would prevent you from getting the vaccine unless you had some allergic reaction to one of the components. Now, the timing piece, yeah, if you have flu symptoms right now or even COVID right now, you shouldn't get the vaccine at this time. For instance, if you have COVID, the recommendation is that you can wait up to 90 days to get that, so 3 months to get the vaccine because you have some level of immunity. If you're not feeling well right now, you should wait a couple of weeks. If you've gotten another vaccine of any type, you should wait 2 weeks. So there isn't anything that's a barrier. Even pregnant women can get the vaccine. Really, the only people who can't are children 15 and younger because there's no approved vaccine for them.
Oh, right, of course. So you are recommending that if somebody has had COVID, that they should still get the vaccine after 90 days?
Correct.
Once I have the vaccine, what does that mean? Does that mean I can stop wearing my mask? Can I have a big party? Is it all over? What does getting the vaccine mean for me and for my community?
So getting the vaccine for you means that you have really gotten an amazing level of protection. What we're seeing is that pretty much nobody gets serious disease or death as a result of being exposed to COVID once they've gotten the vaccination. Do some people get mild symptoms? Sure, but that's not why all of this has happened, is not because of mild symptoms, right?
Right.
So from our standpoint, once you get the vaccine, you're good. Now, the issue we have is that not everybody has had it, right? So the reason to stay masking for now is really so you don't give it to somebody else. It's we're all in this together until enough people have gotten it, and then we'll be able to melt away those additional safety precautions.
Right. So I can have the vaccine. Does that mean I can still carry COVID and infect others?
It means you could, right? So the way the vaccine works is that if you're exposed to COVID, your body's ready to fight it off right away. But you do have it in your body, and that happens with a lot of different viruses. You get it, you don't know you have it, your body fights it off, done. And really the question is your body fast enough at fighting it off that you don't even pass it to anybody else, or do you? And we're still trying to resolve that answer, right? And that's why we're still recommending the mask. And if we can resolve it that you don't transmit, then we can move faster with reducing these restrictions.
Right. So, and this is kind of a little higher level question. So as in terms of how far we are in this disease and understanding this disease, would you consider us still in the beginning phases, or do we understand most of what we're going to know about this?
You know, we're probably in the later innings of this. So we've seen what happens, and you know what happens as it spreads around. We're seeing the variants arise, and that's not surprising. There are many variants. Most of them don't have any different patterns of either speed or affecting severity of illness, and so none of us cared about them. But these variants do, right? They move faster. But that's what happens with viruses. And we have these vaccines that came out really quickly. Really, I think the big thing we're going to be seeing now is, are these vaccines seasonal like we do the flu every year? Or can you go longer without needing a booster? We'll find that out, but we really moved through the phases of a pandemic pretty quickly.
So you expect then that there'll be more vaccines that will be approved in the coming months to a year?
Yes, absolutely. Actually, there's one coming up for approval at the end of this month, so in a couple of weeks. That's the Johnson & Johnson vaccine, and then there are many others that are right at the cusp, and then others right behind them. So as the landscape will look completely different in 6 months, where we'll probably be in that space where if you want a vaccine, you just go get it. We'll actually see a lot of progress in about 3 months.
So we still have to hold the line for several more months, but there is a light at the end of the tunnel.
Absolutely.
That's wonderful. And like you said, we're not sure just yet if this is going to be a single shot, maybe get a booster, or if this is something that we're going to have to do every year or every couple of years. We just don't have enough information. Is that correct?
That's right. The vaccines haven't been out long enough to know the answer to that.
All right. So we'll find out. Well, so and to wrap up, I just have one more question. So, how is your office doing through this whole pandemic? So, from the early days of uncertainty to the rush for the test and the vaccines, you started here in September of 2019. I would imagine that you would have never thought that you would be facing something like this. So, what is that like for you and for the folks in your office?
We talk about this. We say this is what we're here for. We're here to deal with these kinds of public health challenges. I don't know that we could have ever prepared for a once in a century pandemic, though. Nobody has lived through that experience and is still working, at least. And so it's been both tremendously rewarding to be able to do what the community needs in this time of crisis, and at the same time it's also tiring, right? It's been 24/7 for about a year now. And we're still going strong, but I think we're looking forward to the kind of wind down phase of this as well, so that we can maybe just recharge our batteries.
I can imagine. Are you happy with where we are? Are we going in a positive trend? I guess you obviously can't be happy with the numbers, right? Because we want it to be zero.
I do want it to be zero, but the numbers are getting better. And this is a combination of the restrictions. It's a combination of vaccinations. As we get older people, that's kind of the goal, right? As we get healthcare workers who are contributing to it. So this is where the vaccinations really will show up. I'm generally happy with our trajectory.
Yeah. So as we're getting the vaccinations, and obviously we're still in this very early phase, right? Like most people still haven't. Only a few people have had their second shot, even. I won't say few, but
a few
a very small
yeah.
percentage have had their second shot. So, are you seeing then the trends that you'd expect to see as people are getting vaccinated? Are we sort of like on the beginning of what the trajectory should look like?
I think so. It feels like we are. It feels like as our case rate continues to come down, that's part of it. The scary side is fewer people are getting tested, so that complicates it. We see that as case rates go down, fewer people get tested, and then that sort of leads to a rebound because people are not aware, right?
Right.
So it's sometimes hard to tell in the moment how it's going, right? Like you have a better sense after it's happened. But I would say that overall, I do think that we are getting traction. Our big challenge is the variants and just how many at-risk people can we get vaccinated? And once again, that's all about supply. The speed with which it's being done is, I don't think is the big issue.
It does sound concerning that we don't have as many people getting tested, or we're seeing fewer people getting tested. Does that concern you?
It does, but it's historically been hard to get people to get tested when our case rate is low, and once people, and even not even low but decreasing. That's usually when people just kind of wane.
Right. We saw that with the different different sort of spikes, right? We saw people as the numbers went down, fewer people were getting tested, and then we have another spike, right?
And then it circulates. But we have the vaccine now, which has the potential to break that cycle, right?
Yeah. So with the vaccine, then once you have the vaccine, do you need to worry about getting tested?
That's a great question. So we're going to have testing, but it'll probably be pushed into the healthcare system and not as a public health kind of model.
So we can expect sometime down the road that you'll go to patient first or your primary care physician and get your test there. And yeah. Okay. We're seeing sort of changes in the testing itself, right? It appears from what I'm seeing in the news that there's going to be more rapid testing and things. I even recently saw something where you might have an app on your phone for testing. Does that look promising?
I think all of that stuff looks really exciting. Ideally, we have at-home testing like pregnancy tests, right? Like 10 minutes, you do it, you make a decision. That would be the ideal, because at the end of the day, what you really want to know is, I don't want to pass it on to somebody else. Right. If you need medical care, you need medical care. You're going to go there anyway. Right. So I think those kind of tests are fantastic. And the more you give people the power to figure out what's going on with themselves, the more they can do, right? Like, I think generally have this kind of bias towards it has to be perfect and it has to be in the healthcare system, but you miss a lot of opportunities for people to just be engaged in their own health.
Yeah, absolutely. Well, I can't thank you enough for joining me. And I think we are all more knowledgeable for you having come on here, and certainly your outreach here and your regular participation on local television and online interviews have been great and a lifeline, I think, for all of us. So thank you again for doing this.
Thank you, and hopefully I can come visit one day when that's a thing again. So,
yes, you're welcome. Please.
that would be lovely.
It's a pleasure. Thanks. Thank you to all of you out there for joining us today. I'd like to extend a very special thank you to all the healthcare workers and the county healthcare workers who have been working on this pandemic all year. So we really appreciate your dedication and for organizing this interview with us. So check out the webpage and the archive for more details on everything we talked about today. And I also encourage you to check out the county health webpage. I want to wish everybody a happy Valentine's Day, and especially to my sweetheart, Abby. I'll see you in fellowship after the service. Keep wearing those masks and social distancing, and the live stream service will begin in a moment.